Are you an autistic adult that fears needles to the point that you have avoided medical and dental appointments, possibly to the point of putting your health in jeopardy? Well, you are not alone, and you are not broken. There are valid reasons this fear is more intense for many autistic adults, and there are tools that can help you overcome this fear or at least manage it so you can get the medical and dental care that you need for your health. In this video, we will be covering why the fear of needles is common in autistic adults, how to cope with and manage this fear, and advocacy tips for medical and dental appointments. So, let's get started. Hey, Define Yourselfers, I am Chris Mitchell, aka The Confident Autistic, and I'm here to help you live confidently autistic at any age. The fear of needles is very common in autistic adults, and there's several reasons why this is a common experience within our autism community. And they break down into the following categories. And the first is sensory sensitivities. As you know, many of us have sensory issues. Mine in particular is sight. Bright lights bother me to some extent. Clutter drives me up a wall. And noise is too much for me. Okay, those overwhelm me. You may have some of those too. But also, we can be hypersensitive to sensations, to touch, to feel. You know, some of us don't like certain textures. I don't like the feel of corduroy. I never liked it. My mom dressed me in corduroy as a kid, drove me up a wall. I hate corduroy pants when I was a kid. Anyway, so if we have these kind of sensation issues and sensitivities to touch and to feel, it makes sense that we would be more sensitive to a needle pricking our skin or being injected into our body. Another sensory sensitivity that can contribute to our fear of needles is the overload of sensory input in medical environments. There can be a lot of lights, noise, stuff around you in the exam room. You don't even know what it is, and you don't want to know because it looks scary. These things can contribute to our fears. Now, the second category that can contribute to why we fear needles is so much is the fear of the unknown or unpredictability. Now, many autistic individuals or adults, I was trying to say both words at once, didn't work well. Many autistic individuals, especially adults, feel anxious when we cannot control or predict the situation. Now, here's what I mean by all of this, okay? A nurse is going to draw your blood, give you a shot, or start an IV. You don't know the precise moment that is going to happen. You don't have any control over when that's going to happen. You don't know how it's going to feel, and your imagination may have ran away with you. You don't know when or how it's going to happen. That causes you to experience unknown and unpredictability. And as we talked about in other videos, and you may know from your own experiences, we autistic adults crave routine, structure, and predictability. We're not the spur of the moment type of people, okay? We're not. We like things well planned out and to know what's going to happen. It gives us comfort. And when we're going to get a medical procedure that involves a needle, a shot, where a needle would be a shot, a blood draw, or a IV started, we don't know when that's going to happen exactly. The other thing that could contribute to our fear of the unknown or unpredictability is medical settings can feel chaotic or unsafe, especially if you're in a noisy medical environment. Now, if you're in a quiet exam room, it's a little bit better. But if you're in the emergency room, pre-op, post-op, ICU, an open ICU, whatever, dental office where you can get other patients being worked on, that's a lot of noise and chaos going on. And you have people talking, moving around, running around, whatever. That's chaotic. And that can make you feel unsafe. And that's normal. That's a normal experience. Don't Don't think you're broken because you feeling unsafe because the environment appears to be chaotic to you. Additionally, communication barriers cause us to fear needles. Now, it's hard for us to explain our discomfort when we have get a shot or have a needle involved in our lives because we know what it feels like as an autistic adult to be injected with a needle, but there's no way we can explain that to an autistic person because we've never had that experience. So we don't have a way to explain it. They don't have a way to understand it. The best we can do is saying the pain that you feel because of our sensory issues can be amplified 5, 10, 15, 20, 50, 100% time greater than what you feel as an autistic person when you get your finger pricked, when you get a shot, when you get an IV started. It's also difficult for us to explain any accommodations that we may need, especially if the providers don't understand autism. And that goes both for explaining why it's so discomforting for us or uncomfortable and requesting accommodations if the provider does not understand autism. Now, the fourth thing that contributes to our fear of needles is previous traumas or negative experiences, especially those that involve needles. Let's say when you were young, okay? And you're like 2, 3 years old, you're becoming more aware of the world, but you're not totally no understanding everything going around you. And a nurse comes up to you or a doctor comes up to you and just gives you a shot without any warning. It was forced upon you. And that traumatic experience when you're young can leave a lasting impact. That's why some people who work with autistic people who are counselor therapists specialize in PTSD and trauma because we do experience trauma in our life and trauma does stay with us longer. There's also times that we have felt voiceless in medical situations. Taking that example, being 2, 3 years old, you weren't able to say to the doctor, I don't want a shot. What's going to happen to me? You were voiceless in that medical situation. And that can contribute to your current fear of needles. Okay. Or you could have been voiceless. You're in the emergency room, kind of unconscious, whatever, half awake, and they started doing procedures to you and you had no say in it. And that made you feel voiceless, made you feel attacked, assaulted, violated. And those experiences can leave trauma that will resonate with you for years, possibly the rest of your life. Now, even though those are the causes of it, all hope is not lost. There are some ways we as autistic adults can cope with and manage our fear of needles. And the first thing we could try is preparation tools. Ask the medical professional for a clear step by step explanation of what's going to happen to you. Okay? Ask them to give you that. That will give you some control and predictability, and we'll get rid of some of that unknown and maybe make the experience a little bit more tolerable for you. You can also ask the doctor or medical professional for what to expect ahead of time. Now, remember, we talked about we are more sensitive to pain, or many of us are. So the doctor may say, well, you may experience a little pain. Let's be honest. If you're sensitive to pain, you may experience a lot of pain, okay? But ask them what to expect ahead of time so you're prepared. I mean, I go in once in a while for I think it's a CT, but a scan of my heart. I have a man-made aneurysm that has to be monitored once a year, and they give me some, I guess, contrast dye or whatever, right? And they always tell me, and I always ask what to expect. They tell me when it goes through you, you're gonna feel warm sensation. So when it happens, I don't freak out. They told me it was gonna happen, and they also tell me you may feel a little bit dizzy when you sit up after exam. So when I do sit up, I'm not freaked out because of that. So whether it be a needle or anything else, always ask the doctor what to expect ahead of time. Okay? Because those are important things to know. That will give you some control and predictability, which is something many of us on the spectrum need. Additionally, to help us manage our anxiety, our fear of needles, is the use of sensory supports. Now, you could use some numbing creams. Many doctors' offices have that in the office, and you can have that put on the area the needle is going to be inserted or injected into your body or penetrate your body. Now, before you use your own numbing cream, you can bring your own. Check with the doctor or whoever's going to be doing the needle to make sure there's not too much on that could tamper with what they're doing. Maybe if there's too much on there, it could alter the results of a blood draw. Who knows? So ask first. Okay, that's my advice to you. You can also bring a weighted blanket. If a weighted blanket brings you comfort, by all means bring one. Yes, I know they're heavy. That's why they're called weighted blankets. But if it helps you, bring it. You may also want to consider bringing sunglasses to help cut down the brightness of the light in medical facilities, because most doctors' offices and ERs, etc., are very well lit, so the medical professionals can see what they're doing and they don't miss anything. So bring sunglasses. If that helps you with that sensory regulation, the better, because the more you can help your sensory regulation, your normal sensory regulation, the more you're going to be able to manage your fear of that needle and be able to successfully complete a medical procedure. Also, consider bringing and wearing noise canceling headphones. I wear mine practically everywhere I go. And when I get a needle involved in my life, I'm one of these people that are definitely afraid of needles. And I'm going to have a video up about that in coming days. There'll be a link to it in the video description. I have my noise canceling headphones on and I listen to my relaxation music to help me get through the procedure. Another sensory support you can consider bringing is a fidget spinner or something to fidget with, like my fidget spinner, or other grounding device like my needle ball. I take this everywhere I go. So these are things you can take with you to help you feel comfortable. I mean, while they're drawing blood from your arm, squeeze the heck out of your needle ball, whatever it takes to help distract you. That can help. The third thing you can try or do to help you manage your fear of needles is considered underneath the category of control and consent. Ask questions and make choices that can be helpful to you. For example, if you're going to be more relaxed lying down on the exam table while they draw your blood underneath your weighted blanket, ask them, can I lay down for this procedure? Most of the time they say yes. They may say no because maybe you have to be setting up for a certain procedure, but ask first, okay? But never hurts to ask, okay? And no matter what happens, you are allowed to ask for what you need. This is important to know. You are allowed to ask for what you need as long as it's reasonable. That is not being difficult. Asking for a reasonable accommodation is never being difficult. If someone tells you that your request that is reasonable makes you appear to them as being difficult, that's on them, not on you. Okay? That's their problem, not yours. As long as you're polite about it and you're asking for something that's reasonable, you are not being difficult. Additionally, to help you with that fear, you can bring a support person with you. Bring someone with you to your appointments that understands your needs and your fear. In fact, ever since I started dating my wife, she's been to practically every one of my doctor appointments and she's been to every one of my medical procedures. And she understands my fear. First, she didn't, but she's gotten it over the years. And she talks to me and she tries to help calm me down. And that is wonderful, having a support person who is there. And nothing wrong with it. I do it all the time. I'm not self conscious about it or anything. In fact, my wife and I have the same doctors, primary doctor. So we book our appointments back to back. So we're in the exam room together. I mean, I hear everything and she hears everything the doctor says to me. I hear everything the doctor says to her. So it's also a way of showing love for one another and being fully committed to your partner. If your support person is the partner, but whatever works for you. But the point is, if you bring a support person, that can help you relax. Somebody that you're comfortable around, that you feel okay being your authentic autistic self. Now, if a support person is not available to be at your appointment at the time you're going, because of work or other commitments, a video call with a support person can help. I have a horrible fear of needles, and I hurt my hand and I needed stitches in my hand, and I'm in the emergency room. And my support person that at that time in my life lived in Colorado. I was in California. So I called my support person on the phone and talked to her while they were doing the procedure. This is before video technology on phones, so it was just a cell phone call, uh, traditional voice only call. But that helped me get through it. And you could do the same. Additionally, you could try reframing the experience to help you manage and successfully manage your fear of needles and successfully go through any procedure that has a needle in it. And to reframe the experience, you need to say this to yourself: I am not being dramatic. I'm being aware of my body. So when you do cry, whimper, scream, preferably not cuss, but if that's your thing, that's your thing. Uh, you're not trying to be dramatic and wanting attention. You are being aware of your body and you're expressing your reaction to your body. Let's be honest. When it comes to a needle being injected into you, being assaulted or infiltrated by a foreign object that you had no control over. So your reaction is not drama. It just you demonstrated that you're aware of what's happening to your body. Now, when you go and try to get a shot, give blood, whatever, uh, even if you don't succeed completely, celebrate even the smallest wins. Celebrate. You know what? Normally I would have canceled the appointment. I at least kept that appointment. I made it. I didn't get the blood. I didn't get the shot, but I made it this time. That's a small win. And then you can build upon that win and to the day that you're going to be able to get that shot, get that blood draw, get that IV started, and then you're going to experience true victory. Remember, the big moment starts with a lot of small moments. Now, I want to share with you some advocacy tips for when you go to medical appointments. The first is you can bring an autism friendly info card or a sensory needs checklist. Make copies of those, bring those, and hand them to medical professionals. Because sometimes when we're in this environment, we know that we're going to have a needle involved in it with it. Even though we can be great communicators normally, that fear can cause us to lose the ability to effectively communicate and advocate for ourselves verbally. So having an autism friendly info card or sensory need checklist that you can hand to the medical professional can be a way you're advocating for yourself when you're feeling overwhelmed by a situation that causes you fear. Before going to a medical appointment, develop some scripts or phrases to communicate your fears or boundaries and use them at the appointment. You can ask about accommodations before the appointment. You can call in and ask about that. You're probably going to get a weird reaction because that's not a common call the receptionist gets, but go ahead and call. It's okay. If they give you a weird reaction, remember that's on them, not on you. Okay? And so find out about those things and use those. Now, the importance of doctors who are willing to listen cannot be understated. When you're working with a medical professional who is willing to listen to your concerns, your fears, and to work with you, that is awesome. And they're sometimes hard to find people who do that. but these are the people you want to work with. And you find somebody like that, get their name and try to work with them again, because you'll appreciate that in the future. Now, as we're about to wrap up this video, I'd like to remind you that you deserve respectful, compassionate healthcare without having to mask or hide who you are. You're autistic. You have a right to do that. Don't mask. Be yourself. It will benefit yourself, not only that visit, that encounter. It can benefit you later because it could get charted, and next time the staff would know more, and it would make it easier for you. And I'd like to leave you with this confidence-boosting takeaway. Remember this: bravery doesn't mean you are not scared. Let me repeat that. Bravery doesn't mean you're not scared. It means you showed up anyway, and that deserves recognition. Like I talked about earlier, celebrate even the smallest wins. Like I mentioned, if you normally have an appointment for lab work and you normally cancel it, but this time you didn't and you went there, even if you didn't get the lab work done, that's a victory. And celebrate that. Recognize it. And that will help build your confidence to take that next step to the time you can walk in and get that lab work done. Now it's your turn. Do you have any strategies for getting through appointments that involve, or medical procedures that involve needles? I'd love to hear what has worked for you. And so would others who watch this video. Because what worked for you may be an idea somebody else could use that could help them manage their fear of needles as an autistic adult. If this video resonated with you, please like this video and subscribe to the channel for more confidence building content for autistic adults. And be sure to ring the bell to be notified of new videos and when I go live. Until next time, I'm Chris Mitchell, the Confident Autistic, and I am all about helping you live confidently autistic.